Hey everyone, welcome to the Front Row with Ed. I'm Ed Deboo, physical therapist out of Integrated Physical Therapy in Bellingham, Washington. In this video, we're going to talk about how to self-treat lateral ankle pain. So first, some anatomical considerations. The bigger lower leg here, this is the right leg by the way, this is the outside of the right leg. The bigger bone's called the tibia, the outer one's called the fibula. Oftentimes what happens, especially after an ankle inversion sprain, remember where the bottom of the foot kind of rolls, it's named for the bottom of the foot, so it's an inversion sprain. What happens is we stretch what's known as the anterior talofibular ligament. The ligament is so strong, what it tends to do is displace this fibula a little bit anteriorly. And then what happens is it restricts the ability of the ankle to dorsiflex, and it affects the fibularis, which is a muscle back underneath through here. So let's quickly meet the muscle.
The first muscle we were interested in is the Fibularis Brevis, and you can see it starts higher up on the lateral part of the fibula, traverses down behind the lateral malleolus, and inserts the base of that fifth metatarsal. The second one we're interested in is the Fibularis longus, and from this angle we're looking at the bottom of the foot because the tendon attaches at the base of the foot. Both of these muscles can be responsible for pain. If you were new to trigger point work, a basic concept you have to understand is that the location of the tender points are often away from the area of pain sensation. So in this example, the peroneus, which is also the fibularis, where the two X's are actually where the trigger points are, but the pain is in red down at the lower part of the ankle. So it's important to explore the whole area when you're doing trigger point work and not just the area that is painful.
So you can see how those muscles start on this lateral fibula and then come down and attach on the fifth metatarsal, and the longest comes down and attaches on the undersurface of the foot. What you're going to want to do is get two tennis balls and tape them together. So I lovingly refer to this as the peanut. So if you've been to the clinic before, you will have seen the peanut. It's a great little tool to do some myofascial and some trigger point work yourself. First, I'll demonstrate on the model what it's going to look like. When you're doing the trigger point work, you want to explore three different positions. The first position is with the foot basically at 12 o'clock pointing straight up. And you're going to roll, and we're going to focus this just on the lower or the distal part of the tibia and the fibula. You're going to roll anything that might be tender. What you'll do is you'll concentrate your motion and spend about 30 seconds to a minute per sore spot. So first you'll do with your foot straight up and down, 12 o'clock. Then you're going to rotate the foot laterally to about 2 o'clock. Do the same thing, go back and forth, explore it, see if there's anything that's tender. If it is, you're going to camp out there for about 30 seconds to a minute. Trigger point work should be slightly face cringing, so you're going to be okay. Then finally we'll go to about 10 o'clock and also see if there's anything on the inside tibial shaft that might need to be worked out. This is what it would look like if you were doing it on yourself. You may not be able to see the angle, but first my foot's at 12 o'clock. I'm going to use my opposite foot to give me a little bit more pressure, and I'm going to roll first. Remember the distal part of that. Then I'm going to turn my foot to the outside. You may not need to put the weight of the other leg on there based upon how tender it is. If you need to put a little bit more pressure, you can use the weight of your other leg on there to create a little bit more force through that area. And the last position would be at about the 10 o'clock position. We roll it onto the inside, and then once again you're going to roll back and forth on there. And of course you can do this on the floor if you need to. If you find that this sequence works and it helps to alleviate some of the lateral ankle pain that you're having, you can repeat the sequence up to 2 times, maybe even 3 times a day. Remember not to overdo it with the trigger point work because you can make it sore. Now in the event that the tissue does become a little bit bruised, it's not a big deal. Just wait for a couple of days, let it settle back down, and then go back to it, but just not at the same intensity. All right, if you have any questions, please let me know. Make sure you make your peanut. If you have any questions on how to make the peanut, just drop a comment down below, and good luck.